Hello and welcome to this month's Team Brief podcast. Today I'm on the vascular ward at Preston talking to the team about NHS Change Day, which is happening next month. NHS Change Day is a nationwide event that's taking place on the 19th of October, and it's the biggest day of collective action for improvement in the history of the NHS. So get thinking about what ideas you have and what you can do to make a change. So today I'm here with Catherine Silcock and Tracy Wells, who are both involved in this initiative. Tracy is our lead for NHS Change Day. So Tracy, what's it all about?
Thank you, Karen. NHS Change Day, as you say, is a national event, and it's about how do we harness the collectivity of frontline staff to be able to make little changes. We all know within our area what changes that if we did, whether big or small, would make a big improvement. So it's about collectively on one day coming together and thinking about that and then planning things to be able to make those changes. It's about the frontline staff having that power to do.
Excellent. Catherine, what sort of things have we already got involved in?
Well, there's loads of initiatives that we've got involved in. I mean, we're here today on Ward 15, which is our vascular ward. We're sat in the patient lounge. We call it the VIP lounge for vascular inpatients. And I think what's really relevant is that the staff did a bit of a changing room update on this. They recognised that they needed a good environment for patients to come into, and the families who often travel quite a distance, somewhere to come and have some time out. And what they did is they came in at the weekend, on the time off, they brought families in as well. They fundraised for all the equipment in this room and created a lovely space for the families and relatives to come along with the patients. The other thing that they've done, and it's going to be held here this afternoon, is they've created a support group. It's called the Vascular Inpatients, or the VIP support group. So they hold that once a week, and patients come from outside, come back to it. It's something that can be led by the staff on the wards. The physios have been involved. The students have led some of the sessions. It's been a fantastic initiative. We've had some great feedback from patients around that as well. So there's loads of really great ideas. Some of them are bigger and some of them are small. I'll just tell you about this other small initiative. We've got these little packs together on some of the wards now, and it's about how we support our uniform policy. So we've got emergency packs of makeup wipes. We've got nail varnish removers and hair accessories, because obviously we are supporting the uniform policy, and it's absolutely great today to see that our manager and our exec leads are also supporting our bare below the elbows, our hair up initiatives, and it's just the small things that we can do to make it easier for staff.
Excellent. Thank you both very much indeed. So we're looking forward to finding out from everybody else the sorts of things that you might be able to do. So suggestion boards will be put up around wards and departments for you to submit your ideas, and there'll be loads of activities taking place on the day, including myself and the other executive directors coming around to talk to you about your ideas, as well as a coffee break for you to share your thoughts with people you may not normally get to speak to. So keep an eye on the intranet for more details. Next, I'm delighted to tell you that we have just approved plans to open a new chemotherapy unit at Chorley. We're investing in excess of £2 million over the next 2 years to extend our chemotherapy service to Chorley, in addition to the chemotherapy treatment that we provide at our cancer centre at Preston. This additional facility means that we'll be able to treat more patients and reduce waiting times, as well as providing care closer to home for patients who live in the Chorley and South Ribble area. This will be a nurse-led day case unit, very similar to the chemotherapy unit at Royal Preston, which enables us to deliver treatment to cancer patients without the need to stay in hospital overnight. A huge thank you to the Rosemere Cancer Foundation, who donated a large sum of money to the project to fund chemotherapy chairs and to help decorate the new unit, which we are expecting to open towards the end of the year. Now, just a quick update about the emergency department at Chorley. Last month I told you that I had formally requested that NHS Improvement commissions an independent review of the risk assessment that we took that resulted in the agreement that maintaining the current urgent care arrangements at Chorley is the safest viable option for patients at this time. This review has now been undertaken, and we're waiting for the report, which should be issued imminently. Lancashire County Council's Overview and Scrutiny Committee has also recently published a report into the decision. There is an update on the intranet, and we will be issuing our response, and as soon as we've done that we will let you know where to find it. Last month we talked about the tender for the urgent care service for Chorley and Preston. The clinical commissioning groups for Chorley, South Ribble and Greater Preston are responsible for commissioning this service, and they decide which bidder is awarded the contract. We submitted a joint bid with Lancashire Care Foundation Trust and the out-of-hours GP providers at Preston and Chorley to provide this service, but unfortunately our bid was unsuccessful. The CCG has announced that they have awarded the service to a not-for-profit GP-led organisation called GTD Healthcare. It will be a 24/7 urgent care service available at both Chorley Hospital and Royal Preston Hospital, and will deliver GP-led urgent care for minor illnesses and injuries, as well as out-of-hours GP services. There will now be a period in which the new service is implemented, and it will be available to patients this year. We're working with the CCG to clarify how our services and our staff may be affected, but please be assured no jobs are at risk and nobody in any service will lose their jobs as a result. Now, most of you will be aware that the Care Quality Commission has announced that they'll be carrying out a full inspection of our hospitals at the end of this month. The CQC is the equivalent of Ofsted for healthcare. They are our regulators, and it's a legal requirement for them to inspect hospitals. There will be around 40 people on the site during the 3-day inspection, and they'll have access to all areas. I have delivered the presentation that will be shared with the CQC to our staff ahead of the inspection, and we're also holding staff drop-in sessions for you to ask any questions about the inspection. So for our managers, you should be speaking to your staff about what they may be asked during the inspection. And over this period, the CQC will be holding workshops for you to tell them what you think about working here and the care that you provide. Details are on the intranet. They will also be holding stalls the week before the inspection to talk to our patients and visitors, so you may see them at the main entrances at Preston and Chorley. Next, I just wanted to give you an update on our financial position. We've got a huge plan to achieve against this year. It's another efficiency saving of 24.5 million, significant target, and it absolutely requires all of our efforts to achieve it now more than ever. We've made some fantastic progress, and I know that you've all been working extremely hard to work more efficiently, but there is still a significant way to go, and it's you, our staff, on the front line who are in the best position to identify areas of waste and inefficiency that you see every single day. Please forward any ideas that you've got to the business delivery team. Now, to help us make necessary savings while we still maintain a high level of service and care for our patients, we're offering the mutually agreed resignation scheme again for a limited period. The current scheme is open only to non-clinical staff and enables those who are eligible to apply to voluntarily leave their jobs to receive a payment to create vacancies that either don't need to be filled or can be filled by redeployment from other posts that don't need to be replaced. The scheme is open until the end of the month. Look out for more details of how to apply and for the eligibility criteria on the intranet. And while we're talking about working more efficiently, the space utilisation programme is now well underway. The business delivery team have been holding workshops to review how space is used in our hospitals, and over the next month they'll be holding the second round of workshops. They're in the process of drawing up a new policy to ensure that all areas are being used well and appropriately. From now on, you can't make changes to your working space without speaking to the Space Utilisation Group first, so contact the Business Delivery Unit for more details. And a while ago, we talked about labelling your mail properly for the post room and how it can lead to big savings. I'm really pleased to say that many of you have made a huge effort to do this, and we're already seeing a significant reduction in costs, so thank you to every one of you. So now let's take a look at our performance figures. I'm delighted to say that we've achieved our highest ever result in terms of harm-free care. Fantastic achievement, well done to everybody involved. We've also achieved great results in terms of patient experience, in particular for the emergency department, where we have struggled previously because it's been so busy. But the team achieved above target last month, which is brilliant. A full breakdown of our performance figures can be found on the Word version of Team Brief. Well, now it's that time of year again where we all need to get our flu jabs. Flu kills around 8,000 people in England every year, and we want every single member of staff to have the vaccine to protect yourself, your family and our patients. Now, we've got a target of at least 75% of our frontline staff to be vaccinated, and we're committed to achieving that target, and we're going to make it as easy as possible for you to get the jab. Nurses will be offering the flu jab out in the wards and other clinical areas. There'll be drop-in sessions in the restaurant. You can book an appointment with occupational health. You can even win a prize. A schedule of where the vaccinators will be during the first week of the campaign can be found on the intranet along with the prize details. Please make sure you protect yourself, your family and our patients. It's also time to complete the staff survey. It's about to open again and it's a fantastic opportunity for you to have your say and make a difference. Last year, lots of changes were made based on your feedback. There's a video on the intranet and on the network screens around the hospitals which explains it. Thank you to all the staff who took part last year. 35% of staff responded in 2015, but this year we want even more staff to have their say. The survey is completed entirely online and you'll receive an invitation via email. Your answers will be anonymous, so please be honest and help us to make a difference. Also, we expect all managers to give staff the time and opportunity to complete the survey. It's really important because we value staff voice and staff experience, and we know that it directly impacts on patient care. The CQC and Department of Health also review our staff survey results. I expect all managers to promote the staff survey to your teams and you support staff in completing it. Our managers are expected to achieve a response rate of at least 45% in their areas. The staff engagement team has produced a manager's toolkit to help you. It's available on the intranet along with plenty more information about the staff survey. We're looking for equality and diversity champions to help us celebrate individuality and support staff regardless of age, race, gender, disability, religion, belief, sexual orientation, marriage or civil partnership, maternity or transgender. We want every single member of staff to feel valued and supported, and we have a zero tolerance policy to any discrimination. Our equality and diversity champions will play a key role in promoting a positive working environment where staff are treated fairly and with respect. If you would like to become an equality and diversity champion, you can arrange a meeting with the Workforce and Education Director, Karen Swindley, to discuss the role and find out what it involves. Next, a date for your diary. We're holding our annual members meeting next month, which is an opportunity for our staff and the public to come along to hear about what has happened over the past year and our plans for the year ahead. You can register online to confirm your place. And this month is Active Travel Month, where we're all encouraged to be more active. There's a whole range of activities taking place and there are even some prizes up for grabs. Take a look at the Health and Wellbeing page of the intranet to find out more. And finally, I'm pleased to say we're about to launch our new intranet. The digital communication team and IT are in the process of building the new site, which will be much more user-friendly, and it's designed to be able to be viewed on tablets and mobile phones as well as desktops. Initial feedback from user testing has been really positive, and there'll be training sessions for staff who would wish to become editors, as well as instructions online for everyday intranet usage. Keep an eye out on the intranet for more details. And that's it for this month. Thank you for listening and please join me again next time.